Good afternoon, everyone. I'm Chuck Friedman, the co-chair of the Learning Health System Collaboratory. It's a pleasure to welcome you to today's webinar session. We're going to be hearing about the Swiss Learning Health System National Initiative from Dr. Stefan Boos and Sarah Montville, Dr. Sarah Montville. And we are really delighted that they are spending some of their evening with us to give us an opportunity to learn about all of the exciting work that is being done in Switzerland with the learning health system concept. I want to remind you all that the session is being recorded. The link will be shared with all attendees. The session is closed captioned. The chat pod will not be available, but as you'll see in a moment, we have enhanced the Q&A, and the Q&A section of Zoom is available to everyone who is attending. We would really like this session to be highly interactive. So please, at any time, post your questions to the Q&A pod throughout the session. In order to make the Q&A more interactive, we've added some features to the webinar format beyond what we have done before. There will be an opportunity for all attendees to see all of the questions that have been put forward by the attendees. You'll have a chance to upvote questions. I'll be choosing the questions to be put to our speakers, and it's very possible that we will have more questions than we have time for the panelists to address. So if you take the time to upvote the questions that you think are of most interest, that will be a guide to me in choosing which questions to give priority. You also will have the opportunity to ask your question yourself. If you wish to ask a question, we will unmute you, and I think it would be a very good idea if you ask the question yourself in your own words. Next slide. So our outstanding speakers today are Dr. Stefan Boos, the Vice Principal of the Department of Health Sciences and Medicine and Professor of Health Economics at the University of Lucerne in Switzerland, which is the home to the Swiss Learning Health System project. I've had the opportunity to visit Lucerne and learn about the exciting things they are doing. And our other additional second speaker, I actually don't know in what order they're going to speak, will be Dr. Sarah Montville, the research manager and coordinator of the Swiss Learning Health System project. Their presentations will be followed by audience question and answer. And I think they may be stopping both Stefan and Sarah at times in the middle of their presentations to entertain some questions. So if you have a question, put it in the Q&A pod right away. Don't wait for the end of their presentations. So next slide, please. Well, okay. So without knowing who is going first, let me ask either Sarah or Stefan, whoever is going first, to begin. Again, thank you both for being with us today.
Thank you very much, Chuck. And Sarah will share the slides with you, and I will actually start. And Sarah will manage the slides because she's much better than me in this kind of things. So welcome very much to today's Learning Health System Collaboratory. Welcome from Switzerland today. It's late afternoon still, not yet evening, but given the time difference that we have and the time that we planned for the Collaboratory today, it will well take into our evening here, but it's our pleasure to be with you here today and to present what we call Swiss Learning Health System, which is a national initiative to support evidence uptake in policy and practice. Next slide, please. What I would like to, really reinforce is what Chuck said. We want this session to be, highly interactive. We want to, talk to you about the Swiss Learning Health System. We will present the Learning Health System, but of course we would be very, very interested in getting your insights and your opinions about the Swiss Learning Health System, and perhaps some feedback on how we can move this Swiss Learning Health System forward. To start, what I would like to do is, just give you maybe a bit of a perspective from Switzerland, just to, have things in sort of in proportion. And I did a few things. So first of all, what you can see in the map is a map of Central Europe with Switzerland in the center. And I put an overlay of the state of Michigan on top of that in the shaded area. And you can see that Switzerland is a small country. It's smaller than the state of Michigan. And you can also see that in terms of some numbers. If you look at population size, Switzerland has about 8.5 million, which compares to about 10 million in the state of Michigan. But nevertheless, Switzerland is an interesting country for many reasons. Again, just to sort of give you a few parameters about the country. Switzerland is one of the richer countries in the world. We have a GDP per capita in purchasing power parities of about $72,000. That's ranked 6th in the world, according to the International Monetary Fund ranking. This compares to the US, that is at around, I think, $67,000 per capita of GDP. Our country has a federal state system, which is not too different from the US, but probably has a higher level of democracy. We have a semi-direct democracy in Switzerland. The health system is important, actually not as important in terms of relative size of GDP as in the US, but nevertheless, we are at 12% of GDP per year. Which I think ranks Switzerland number 2 or maybe number 3, depending on what ranking you look at in the world. And of course, the US here is number 1 in basically all rankings. Life expectancy at birth as a health indicator is at 84 years, is a bit higher than in the US. Overall, the opinion about the Swiss health system, at least by the Swiss population, is quite good. So typically, if you ask Swiss people, how they would value healthcare overall, they would say they're quite happy with it. Now, before going on, what I would like to get from you, and again, sort of following Chuck's recommendation to design this session a bit more interactive, I would like to get your perspective of Switzerland. So Sarah, if you could stop sharing the screen, and I will share my screen for a few minutes. And I would like you to go online to this website called www.menti.com. And if you enter this code 5302113, then it will ask you a question. What comes to your mind when you think about Switzerland? And we really would like, your very spontaneous thought about Switzerland. Basically anything that comes to your mind, first thing that comes to your mind, just, put this in the field and enter that. And let's see what we have on the screen. And you can follow that directly. And perhaps let's wait a few seconds. You can also see in this word cloud sort of those expressions that are repeatedly entered in the form. They appear in sort of larger font sizes. So there is some sort of focus on at least a few elements that we can see here. So I see chocolate, I see mountains, I see neutrality, I see cheese, I see Alps like mountains, so that's sort of in the same direction. I see a bit smaller, multilingual, the three national languages, French, German, and Italian. I see expensive. And that's actually quite interesting. So let me perhaps comment on a few things. So, I mean, first of all, when we think about the mountains, that's actually, I mean, something that is very characteristic of Switzerland. And it very much links also to the health system. And that's something that perhaps is less known, but nevertheless, I mean, also for a learning health system, very interesting. We have, I mean, quite a rural-urban differentiation of health services provision. And that goes as far as, I mean, having a saying that we have, I mean, basically one hospital in each valley in the mountains. So the overall number of hospitals in Switzerland is quite high, and that poses certain challenges to services provision, especially when we think about the efficiency of services provision. So I think that's something that might not be, I mean, something that you directly relate to mountains, but nevertheless is something that, I mean, at least the Swiss health system faces as one, I mean, example of a challenge. The other thing that might be quite interesting, I mean, linking back to chocolate and perhaps milk, cheese, milk that we need for chocolate and cheese. What is quite interesting is, I mean, that's something that came recently up. If you think about risk management of a pandemic like COVID-19, the Swiss cheese model has become very popular again, with different layers of interventions that are actually needed to tackle such an intervention, such a health crisis, if we want to call it like that, in the sense of hygiene measures, masks, distancing, and other kind of interventions like business closures, school closures, depending on what kind of level we want to target in the pandemic. The other thing that might be interesting, it's a bit less visible, but I saw expensive, I saw money, and we have seen that on the previous slide. So, I mean, overall, I mean, the Swiss health system has been perceived of relatively high quality, but it's also quite expensive. And the cost development, similar to the US, I mean, is positive on a very high number. So we have cost growth in the health system that, I mean, is at least for policymakers, but also for the population seen as too high. And there are several initiatives now to contain costs. And that's also something that we'll come back to a bit later when we talk about learning health system activities in Switzerland. Good, so let me close that. And perhaps Sarah, you can share the slides again. And in the next sort of or few minutes, what I would like to do is first, I mean, give you a little bit of background, I mean, why we have a Swiss learning health system and where this Swiss learning health system comes from. And then Sarah will talk a little bit more about what the Swiss learning health system is. And then I think after that, we will have a bit of time for questions and answers. And then for the second half of our presentation, what we have in mind is that we look a little bit into the future. So where does the Swiss learning health system go? And for that, it might also be very interesting to get your insights. And I think at the very end, we will have enough time for discussion around this. So next slide, please. So the Swiss learning health system is a network. It is a network of academic institutions. We have 10 universities or universities of applied sciences. Some of them are called like that in Switzerland. Universities are really academic institutions. Universities of applied sciences are also tertiary level institutions, but a bit more vocational oriented. And the health professions in Switzerland are mainly located in these universities of applied sciences. But the Swiss learning health system spans both types of institutions, academic institutions. Overall, there are 13 institutes and departments involved in the Swiss learning health system. Next click, please. The Swiss learning health system is running since 2017. So we are now in the 4th year of this project, or we are actually entering the 5th year. And we received funding from the government for this initiative to establish the Swiss Learning Health System, from the national government, from the federal government, that allowed us to sort of, implement this infrastructure that is needed for the learning health system. This was an initial funding for 4 years, so for the first 4 years, and we just now, this year, 3 months ago, started the second funding phase. So we received a second funding, again, from the same institution, government, federal institution, with about the same amount of money that is involved. The Swiss Learning Health System actually came, or the idea for the Swiss Learning Health System came based on this roundtable discussion in the US on the learning healthcare system, and related discussions that have been going on in the US, initiated by the Institute of Medicine. So we were inspired by these ideas, and we, as sort of, thinking about it from the Swiss perspective, thought about how could, this be implemented in the Swiss context. And the exact details Sarah will mention then afterwards. Next slide, please. What is our overarching objective? Our objective is to strengthen the health system and create a culture of shared decision-making in which sound scientific evidence is continuously integrated in the health system. So we really want to live this idea of learning systems, learning cycles, where scientific evidence, sound scientific evidence, is integrated in the health system at these places where it's needed. So this is really, at the core of everything that we do in the Swiss Learning Health System. And you will see that later in terms of the mechanisms that the Swiss Learning Health System has established over the last 4 years, the way that we live that. Next slide, please. Why was there a need for a Swiss Learning Health System, and where did this come from? In 2012, the Federal Office of Public Health, which is a government institution, which is basically, responsible for everything that relates to the health system in Switzerland, has issued a report where they emphasize the need for strengthening health services research. This was, at least based on their assessment, basically inexistent in Switzerland up to this date. And they also, emphasized that we need more coordination of activities related to health services research. They also mentioned that there is a lack of a structured network among different stakeholders, not only in research, but basically across the entire health system, and that there were no targeted funding mechanisms to support health services research in the country. 3 years later, this assessment was basically confirmed with a little bit of development. Actually, we started with a little bit of funding mechanism. In 2012, there was a funding program initiated by a relatively important and large foundation in Switzerland that started several research projects in the area of health services research. But around this time, also the Swiss Academy of Medical Sciences, they assessed the situation in the country, and they also emphasized that there is a need for the development of health services research as a third pillar besides biomedical and clinical research. And that was sort of the initiation of this idea of a Swiss learning health system. They also called for a national infrastructure that helps to translate evidence into policy and practice. And this was sort of, really the core, call for the Swiss Learning Health System. And our team at the University of Lucerne at this time developed a proposal how this national infrastructure could look like. And we proposed the Swiss Learning Health System. A bit later, in 2017, or a bit earlier, of course, the idea was generated. but to respond more specifically to a targeted funding mechanism and more, systematic research in the area of health services. There was also a national research program which was supported by the Swiss National Science Foundation, which is the largest science foundation in Switzerland that supports specific programs, but also projects. And that's been going on since then. And in terms of research, I think we have created a lot of capacity in Switzerland since then. And the Swiss Learning Health System takes the role of supporting or providing mechanisms that help to translate this research into policy and practice. So these things go hand in hand, and the Swiss Learning Health System plays the role of sort of knowledge translation and implementation. Next slide, please. In terms of the conceptual framework, we are working in the framework of the World Health Organization, the Health Systems Framework, with its 6 building blocks, but also the overall goals and the processes that we look at. And actually, the representation that I like most is the one that you can see on the left in orange red, which is the health system strengthening perspective, with people at the center of the health system that govern the health system, that steer the health system, and that play a role at basically everything that we do. And based on that, we developed a framework how, this knowledge translation in terms of how to bring evidence into policy and practice has been developed. And with this, I would like to give the word over to Sarah, who will say a few more things about how our mechanisms actually look like.
Okay, thank you, Stefan. I'm going to talk about the mechanisms or the core pillars of the Swiss Learning Health System now a little bit. So how are we actually trying to bring research into policy and practice? And I start actually with, this is the very core of our initiative or our project. And I'm going to talk about it much more in detail in a couple of minutes, but just very briefly, what we try to do in the SLHS with all our partners is to continuously sort of scan the Swiss health system landscape and see what are new and emergent issues, which issues and challenges are relevant right now. We prioritize these issues. Based on that, we develop evidence synthesis or policy briefs, as we call them, that provide a number of recommendations for actions or courses for actions. And those policy briefs, they are a standalone product, of course, but we also use them as a basis for stakeholder dialogues. And these are organized stakeholder dialogues with stakeholders that, of course, have a stake in the issue or the problem that we're addressing, or a particular interest in that issue. And from an SLHS perspective, afterwards, we of course look or try to monitor what sort of changes do occur after the dialogue, whether, for example, some initiatives for implementation have started, etc. And then learn from that or try to learn from that experience. Did things change? What changed? What are still gaps that we might have to address, and to feed it back into our learning system? But as I said, I'm going to go a little bit more in detail through all these different mechanisms in just a couple of minutes. Another important pillar for us, so I want to talk very briefly about the 2 other pillars before coming back to our learning cycle, is building scientific capacity in the field of health services research, as well as learning health system and sciences and our mechanisms. So we are a project that is currently also funded through PhDs. So every partner institution has 2 PhD students that work in one way or another also on the development of policy briefs and the conduct of stakeholder dialogues, which of course oftentimes are related to their doctoral dissertation. So this is one way how they learn about the mechanisms. They learn how to write policy briefs, do evidence synthesis, how to conduct a stakeholder dialogue, and trying to bridge this gap between their own research, being in their little ivory tower and reaching out to policy and practice. But we are also offering courses in the field of health services research, but mainly learning health systems or sciences, and which we do in collaboration with the Swiss School of Public Health. And maybe for you, that's a bit of interest, is Switzerland is fairly small, so there is no university that has an own department or faculty or school of public health. So the Swiss School of Public Health is a program that brings together, I would say, even nearly all universities and universities of applied sciences in Switzerland, because all of them have somewhere an institute or a department that somewhere works in the field of public health. And we officially collaborate with the Swiss School of Public Health to offer courses to not only our PhD students, but also PhD students that are in other programs or attached to other programs. Also, we have around 20 to 24 PhD students continuously in our project, but they are hired at the different partner institutions, of course. The third pillar is, and Stefan is going to talk a bit more in detail about this, also concerning now the second funding phase, is that we want to develop standards for the management of health information. And this broad categorization initially referred to the fact that given that we write evidence synthesis, and a lot of the evidence synthesis or policy briefs that we are writing are based on studies and research that is conducted elsewhere, often from the United States, Canada. We're always looking, how can we actually put the findings that we find into local context? And oftentimes we look for data sources that we can use to replicate, test for findings, replicate findings, test for hypotheses that we found. And so one idea is to make health data sets available, or data sets that are related to health, more easily accessible. Available is the wrong term, but more easily accessible. So along with one of our partners in the French-speaking part, we developed now a first pilot application of a metadata repository where people can have access to health data sets or health-related data sets through different mechanisms. But as I said, I want to speak a little bit more about our different mechanisms. So as you are all well aware, is the idea of a learning health system in a clinical setting is, and very briefly, is saying that you generate data, you learn from that data, you bring these learnings back into practice, you generate new data, you learn again from the data, etc. The idea with the SLHS, as Stefan has also mentioned already, was sort of, can we actually leverage this mechanism to sort of policy level or decision-making level? So this is our learning cycle, which looks very round, but we're also well aware that sometimes things are not as smooth as they are depicted here. And as I said before, what we continuously try to do is to look what is happening in the Swiss health system right now with COVID-19. Unfortunately, one has to say it's a bit easier, of course, and we try to prioritize these issues. And I think it's fair to say that during the first funding phase, this identification of issues was still quite academically driven because we were an academic initiative. However, through the course of the 4 years, I think we were able to identify more and more issues that are truly relevant to practice and policy, because we were conducting more and more stakeholder dialogues, our network was growing. And also for the second funding phase, it is foreseen, and also here Stefan is probably going to talk about it a bit later, is that we really want to give stakeholders from policy and practice and decision makers a seat at the table at the SLHS, not only as a sounding board for us, so what we do, is this truly relevant, but also to get their ideas on what they think we could address with our mechanisms. So as I said before, based on that, based on the prioritization, we develop policy briefs. And these policy briefs normally summarize, they describe the problem, summarize the available evidence. As I said, oftentimes that's comes from international studies. So we try to pull out also a couple of data sets and look at whether, as I said, we can replicate maybe findings, find the same patterns in Switzerland, but also we try to look at best practices. So if something has its way found into implementation, what can we learn from countries that are, for example, similar to Switzerland? So in our case, for example, we oftentimes look also to the Netherlands or Scandinavia. What have they be doing to put it into a more local context? The main part of the policy briefs, however, are, as in every policy brief, are recommendations. So we provide a minimum of 2 to 3 recommendations on potential actions or course of actions. And These policy briefs, as I said, they can be a standalone product. If people are interested, we publish them on the website or we try to share them across our network. But the idea is that they really serve as an input for stakeholder dialogues. I just wanted to give you a brief idea about what our policy brief looks like. These are just 3 random policy briefs I drew, so to say. One we did was on patient-reported experience measures for cancer patients. So there has been, and I admit that, a bit of an academic push to include more patient-reported experience measures in cancer care, and in particular to think about how to collect this data in a more systematic way, also in terms of the cancer registry in Switzerland. But there has been also an increasing interest from the patients to actually share, of course, their experience in that regard. So we developed, or the 2 authors of this policy brief who are part of our network, developed a policy brief, looked into what has been done in other countries, what do we know, what works, how can we actually implement it, what other initiatives are going on in other countries in Europe, and what could be transferable to the Swiss context, and what are potential facilitators and barriers. Another policy brief dealt, for example, with how we can implement the international guidelines for knee osteoarthritis management in Switzerland more systematically. This is something that has been going on quite a bit in the Scandinavian countries, but efforts were less so in Switzerland. And unfortunately, that's a bit hidden in the back. It's also, the title is in German. We wrote in collaboration with the Federal Office of Public Health, among others. We wrote 4 policy briefs on interprofessionality. So how, for example, to strengthen interprofessionality in education in Switzerland, how to strengthen an inpatient or outpatient care, or at the intersection of psychosomatic care. On a side note, interprofessionality is, compared to the US, it's still we're still a little bit behind. So for example, the concept of advanced nurse practitioners is still relatively new in Switzerland. And we try to address this with another policy brief, for example, because there is not yet a real legal basis for these. The education is available, but there is no actual legal basis or sufficient legal basis for these people to actually, for example, work in outpatient settings. So as I said, these policy briefs, they serve as an input for the stakeholder dialogues, and these are very structured dialogues. So it's not, oftentimes people think when they hear stakeholder dialogues, it's you meet stakeholders once in a while, you try to have a continuous conversation with them, but these are really dialogues where we try to bring stakeholders together through stakeholder mapping that have an interest in the topic, but also stake in the topic, and maybe are also decision makers on that topic. And we try to capture a broad variety of different opinions, so that we're not already coming with a group where we know all these people are of the same opinion. As I said, this is very structured, those dialogues. We started off, of course, with a very theoretical concept that it's a structured communication process that uses a deliberative dialogue. So we're using a moderator, sometimes a facilitator. And the idea is really that, first of all, we need to find common grounds. Can we agree that we're all talking about the same issue here? And already this takes a little bit of time. And once we've agreed that we understood, or hopefully agreed on, that we're all on the same page when it comes to the actual issue, work towards potential actions or discussion of the recommendations of actions and the course of actions that were presented, among others, in the policy brief. We normally hold these dialogues for about a day if we can meet offline. Online, we have shortened this quite a bit. It's a highly structured process that we apply. If it's online, as I said, we have narrowed down to half a day, because we know we get tired after a while with spending too much time online. And this is then even much more structured, where we use breakout sessions, for example, to give really people the opportunity to participate in the dialogue. As you know, it gets difficult. The more people you have online, the more difficult it gets to actually really engage in a dialogue. Also, maybe that's of interest to you, we normally work in smaller groups. So we say a maximum of 15 stakeholders, participants should join the meeting to really also allow for substantial discussion. Maybe also something still to mention that is something that is important for us and also for the stakeholders is that we always follow the Chatham House rules. So all the participants are allowed to use the information they receive freely afterwards, but they are not allowed to name the organizations that have participated or the names of the people that participated, because we know that people not only come as representatives of their organizations, but they also come as people with their own experience. And especially in Switzerland, because Switzerland is very small, people can easily move from one organization to another job-wise. A lot of people know each other. So we're well aware that there are also not only organizational dynamics, but also sometimes personal dynamics. And we want to ensure that people can really freely talk about the issue. So this leads me actually to my Menti Meta, as Stefan has done before. So we are still sort of in a learning process, of course. It was the first funding phase, and we have realized that there might be a different potential outcomes of a dialogue, among others, a planning of course of action, a mission or vision statement, signed agreements, maybe the development of a toolbox, or what also can pop up is a further additional research. So I'm going to stop my presentation right now, and Stefan is going to take over again, because I would like to ask you, which do you think, and really this is also about learning from your experience or your expectations, maybe, what do you think is the most likely outcome after a stakeholder dialogue? I hope it works. It's the same process as before. Just a couple of more seconds.
I actually see that, I mean, at least we should notify the tool developers that maybe violet, some blue and some other blue is not sort of the ideal color differentiation in a pie chart.
It's true.
While we're waiting, can I just make a comment that we've had a bit of a technical problem with Zoom, and I understand that the participants cannot see each other's questions, as I had earlier said they would be able to do. We apologize for that. However, the panelists can see your questions, so rest assured that your questions, if they are posted on the Q&A, have been seen, and you will be recognized when we get into the Q&A session. Excuse the interruption.
I don't know, Stefan, if maybe you want to take a look at the questions, or should I can also continue now with this one and we go back to the questions afterwards.
If you want, I think we can perhaps, I mean, you can comment on this graph and sort of complete this section. And then once we are done with that, we can have a look at the questions and answers.
Oh. Okay. So, thank you for voting. I mean, for us, as I said, it's also interesting to know what you might think. I mean, I would be curious to know, and I don't know if the person would be willing to tell, or maybe there were two people that said other, would be curious maybe to see what others could relate to. In terms of further additional research, yes, this is something indeed we realize, and it's sort of also, we could say, the easy way out. Sometimes some stakeholders say, well, we don't know, there's not enough research in Switzerland. And this is something that we're also still a bit struggling, unless someone really afterwards comes and tells us this is sort of the research we need, and it's also, of course, relates to funding. So this is, of course, sometimes additional research is needed, but it also can be easily used, as I said, as an easy way out for stakeholders, which also leads us, and that is something maybe later we can discuss this, and how much we can actually hold people accountable that participate in the stakeholder dialogue. I mean, it pertains a bit to the role that we want to take on. Is we as researcher, and especially now if we think also about COVID-19, do we want to steer people into a certain direction, or are we really knowledge brokers here, for example, and need the stakeholders to take the lead here? So this is something we're also still working on, and how far can we actually make people accountable? So I often say when people ask me like, oh, what should we expect as an outcome of a dialogue? What would be good outcome is if there is maybe 1 or 2 people that are actually willing to say, we're going to pursue this further, or we have really an interest to continue looking into this. And then it's up to us to go back to them and see whether whether they have pursued this in one way or another. This could also mean that they might have pushed it on their agenda in their organization, or they have forwarded the policy brief and have engaged in discussion with other organizations. But maybe this is something we could also discuss later on, where you would see maybe our role in this, because I think, I think Stefan agrees. We often have this discussion whether we are sort of knowledge brokers here, or can we already push an agenda? And as I said, I think especially now with COVID-19, where we see, for example, also in Switzerland, the Science Task Force and the policy side, and there have been a bit of a struggle. Where can we push, or should we not push? And yes, ideally, there, as 43% said, this is sort of the ideal, that we actually can really plan a course of action. However, we deal with topics where, of course, we cannot expect things to change quite freely and very fast. Especially, let's take the example from advanced nurse practitioners, where it's also about really establishing a legal basis, or pushing, and before we even can do that, is bring this into the parliament, for example. So there are a lot of things that we have to take in account. And I initially had said we have this learning cycle that looks very round, but it might not be that round, actually. So
Sarah, we have quite a few questions coming in. Would this be a good place to stop your presentation, or pause it and entertain some questions? Are you open to that?
I mean, if Stefan agrees, it's good.
Yeah, we can do that. Yeah,
okay, I'm just watching these questions come in. And let me also say that I must have invoked Murphy's Law when I said the questions were not visible to all participants, because something miraculously happened, and now they are. So anyway, let me ask a couple of questions, and then either of you could, or both of you could respond. Let me see. Matthew Sullivan had the question that's at the top of the list now. Matthew, we can unmute you if you'd like to ask your question.
Sorry. I was just wondering if the Swiss learning health system partners with tech companies, and if so, to what degree those tech companies have access, and I guess if not, was creating the infrastructure prohibitive? Because it seems like that'd be a really huge investment. Thank you.
I mean, that's an excellent question, and I was going to come back to this also a bit later in the talk, and maybe that might also clarify a few things. Right now, we are not partnering with tech companies. At this point, there are several initiatives in Switzerland that are ongoing that try to establish sort of data standards on different levels, on the inpatient care level, partly also on the outpatient care level. Also on this more social science perspective, data sources that we have. But there is no sort of systematic cooperation with tech companies to support this data infrastructures. And I have to admit, this so far, I think is actually a downside, and we have to address that. And the issue is a bit the coordination on the national level. That's something that we see, and at least from our perspective, from the initiatives that we are part of, or that we try to actually get going, we experience that this seems to be almost impossible to break, because there are so many different interests, and also in terms of the data sort of position that individuals have towards their data and the use of their data. It's extremely difficult. And I think that also relates to another question that was asked in terms of who has access to what kind of data. This is something that is extremely difficult right now. We just sort of this week, I think 2 days ago, we had sort of a major problem with a data leak with this vaccination platform that they wanted to establish for the COVID-19 vaccinations. This was actually, very unsafe. It was a platform that was at least partly supported by the federal government. And I think that was a perfect example for the kind of issues that we are, still having in this country with these kind of things. Now, what is, upcoming, and that's what we try to embark on with the Swiss Learning Health System, is more local initiatives where certain healthcare providers try to team up with larger initiatives on the international level. And I was going to talk a little bit about that later. But for example, in Lucerne, we have one of the largest cantonal hospitals in the country, or actually one of the largest hospitals in general in the country. And they are teaming up with EPIC for, structured data access on the inpatient level. And this is now used to establish a clinical decision support system in the hospital. This has been initiated just last year. They are still in this implementation phase, but I think that's sort of one of these initiatives that I think is more promising in Switzerland than sort of other corporations with larger tech companies. I don't know if that answers your question, but that's sort of the issues that we face right now.
So thank you. We'll take one more question before we move on. And this one goes, I think, to some of the considerations that Sarah was bringing up. This is Pat Rinvelt's question. Pat, are you there? Pat, you're on mute if you want to come off mute.
Hi, can you hear me now?
Yes, sure.
Great. So I was curious about, we have two different types of healthcare systems in Switzerland and the US, and you guys have the universal health care and have a completely different system. And I was wondering if universal healthcare helped accelerate and enable the learning health system you are.
I think, this kind of health system that we already have in Switzerland, already exists since, I think, 1996. And I think this is pretty established. And I think, in a sense, people value this, this kind of system very highly. And the learning health system, in a sense, has nothing to do with that. Where the learning health system comes in at this point, and where we also see this future development, is because it is universal healthcare with this mandatory health insurance structure, and we actually have this what is called a social health insurance system with mandatory, healthcare premiums, and with rising healthcare costs, this puts an increasing burden on, especially on low-income households. And this is becoming more and more a concern. We have more and more people that rely on what we have in this country as a social support system. We have, premium subsidies, health insurance premium subsidies. And more people, need these subsidies right now we are at a threshold of about 30% of the population that receive premium subsidies. And I mean, already with this number, you can see, I mean, if 1/3 of the population needs premium subsidies to pay health insurance, then, I mean, something is wrong. And we actually have now a few, I mean, groups, research groups in our Swiss Learning Health System that try to address this point from different perspectives. One is to, I mean, carefully assess the services that are included in universal healthcare. So there is a standardized package of services that are included. And this is actually very comprehensive. And I mean, this has also been pushed forward from the federal government, that services are now much more systematically evaluated. What services should be integrated, what services should be perhaps excluded from universal healthcare access. And we have established now what we call learning cycles, where, I mean, from the research perspective, I mean, services are systematically evaluated. And then in this process that Sarah described, we try to, I mean, this evidence that, I mean, researchers collect, we try to bring the stakeholders on the table. And of course, I mean, there are different interests. I mean, if you think about, I mean, physicians, providers of certain services that perhaps are then excluded from universal healthcare, then, I mean, of course, there are these different interests that we need to bring together, and we try to, I mean, use our mechanisms, the stakeholder dialogues, in order to move this forward. So I think this is a good example of a learning cycle in the way that we implement it in Switzerland, where, I mean, there is evidence collected, evidence produced by researchers, and then this is integrated or, I mean, try to be implemented in policy and practice through this structured mechanism of a stakeholder dialogue. So in a sense, I mean, like I said, so the learning health system, I think, is supporting the future development of the universal healthcare system. So I think universal healthcare is undisputed in Switzerland, and it works quite well. But we face these challenges, especially in terms of cost developments, and that's where we can contribute something.
Thank you, Stefan. I want to be sure you get through your presentations, and Sarah, I think I might have jumped in before you were finished with the piece that you were in the middle of presenting. So do you want to resume with that?
Okay. Need to open it. So, yeah, so coming back to outcomes, so we briefly mentioned before what our potential outcomes are, but that we're actually also still learning on this and talking about accountability also of stakeholders and how much we can actually push them. But what we do afterwards from the SLHS, and right now this is still moving a bit slowly because, as I said, we deal with topics where change, it can take time until change takes actually place, is that we still try to monitor what's going on. So what sort of initiatives have been taken on afterwards? We also, right after the stakeholder dialogue, we send out a survey asking people whether they have brought up the topic, the issue in their organizations, but also if they might have discussed it in different ways after the dialogue, and if there are any other initiatives or things going on afterwards. And in the long term, of course, we hope that we see eventually changes, that things are moving forward, and we see what we have learned from these new experiences that were collected. We identify whether there are still gaps. We revisit the issues or challenges and look whether there is need for an additional and updated evidence synthesis, additional stakeholder dialogues, whether there needs to be, whether things have been successful, and maybe now we can even move towards additional things that came up after the successful phase. So there are a variety of different outcomes that we expect to see. So also what we have experienced, that through the stakeholder dialogue, new questions came up, and we realized that we hadn't included initially all relevant stakeholders, and that we needed to reframe the whole issue. So there's a variety of different outcomes. And but the idea is that we look at what is happening after the dialogues, we try to learn from it, we see whether we find even, of course, data on these issues, and try to revisit the issues, try to think about whether we need an updated policy brief and another stakeholder dialogue so that we can actually continuously learn. I think Stefan, I'm going to skip the next Menti because otherwise we don't have time in the end to actually have enough time for questions and discussions. But what I still want to highlight, and I've mentioned it already a couple of times, is that this is the idea of our learning system. And as I said, it's a little bit abstract because we have tried to leverage it to the policy level. But we know that policy making is not a straight way, so to say, from A to B. And I actually really like this slide from Gluckman. I hope you can see it, where he says, well, we have this great idea that we look into policy making, there's a problem, we identify options, we choose or we select a policy, implement it, evaluate it. But the truth is there are so many different people and organizations at the table and how issues are moved forward, that of course it's not an easy cycle, so to say. So this is something that one always has to keep in mind. Policymaking is a messy process involving formal and informal actors, elected and unelected. So this was the part on the mechanism of the Swiss Learning Health System. I don't know, Stefan, if you would like to pause here for additional questions, or if we should move directly to the lessons learned.
Perhaps what I can do is, just very, very briefly comment on 2 or 3 questions that have been posted in the Q&A related to vision, mission, and the funding of the Swiss Learning Health System, because perhaps I was a bit brief at the beginning about that. So in terms of vision, our idea is that, we want to design a health system that continuously learns. I think this is sort of the short summary of our vision. And a bit more detail, what this means is that scientific evidence is continuously used and implemented in the health system. Our way of translating that into a structured mechanism is basically the graph that Sarah presented before with this cycle. Our mission is to implement that. So that's what right now what we have to do. And like Sarah mentioned, this takes time. And it's very complex. And we are still, in a sense, young. This Swiss Learning Health System started 4 years ago. And we are still in the process of implementing these things. Basically, the mechanisms are already running. The issue is to bring them to the users. So we want to have that a bit more systematically done in the next few years. And Sarah will comment on that as well. The other aspect is about funding. Just to give you, perhaps some numbers. These are public numbers. This is publicly supported, this project. We receive what is called a matched funding from the Swiss government, which means that the money that we receive from the government needs to be matched by the academic institutions. And we are talking about around 4.5 million Swiss francs that we received from the Swiss government for 4 years. So it's a bit more than 1 million Swiss francs per year. And this is matched by the same amount by the academic institutions. So the academic institutions put in about the same number. So we have an overall budget for 4 years, per year of about 2 million Swiss francs. Perhaps what is most important to know is, what this is financing. And Sarah mentioned this already in terms of this structured process of a learning cycle. This money is mainly used for PhD students, for our research, for our researchers, early career researchers. So this pays the PhD students and their PhD work, their research. And this is the evidence that we generate. This is perhaps most of the money. I would say about 60–70% of our overall budget that goes into the PhD students. Then there is some money that we use for the stakeholder dialogues. So bringing this evidence to the stakeholders. And we need to organize this sort of stakeholder meetings, stakeholder interactions. So that is another part of the money that we use. And the remaining part is for the coordination of the Swiss Learning Health System. So we have these different partner organizations. We need to sort of coordinate the work across the partner organizations. We need to coordinate the interaction with the stakeholders. And maybe that is also, partly responding to another question. I'm not entirely sure whether I understood the question exactly right, but perhaps we can come back to this then afterwards. One of the other issues that we have to be aware of is, of course, stakeholder fatigue. If you run into this implementation process, especially in a small country like Switzerland, you have the danger of, always approaching the same people because they are sort of in these lead roles of decision makers. And this requires also careful coordination. Who is involved in what kind of evidence to policy and practice initiatives. Good. But I think that's it for the moment, and we can come back to this perhaps a bit later. And then I give the word back to Sarah that will talk a little bit about experiences from the first phase.
Okay, thank you. Yes, I'm going to recap a little bit on what were the lessons learned, and we touched upon this already a bit from the first phase. After all, we were successful enough to be funded for a second funding phase, and I think also to sufficiently establish us in Switzerland that people now know, by now people active in the field have at least heard our name, and they know we do policy briefs and then dialogues. So we were able to establish quite a strong academic network of partner institutions that are all very committed to strengthening the health system. We all have a common understanding of the principles of the learning health systems, and we share a methodology that all partners have bought into, so to say. There is an official agreement on core values. We were inspired by that also by Chuck and his efforts. So when we started off, we actually said, okay, we started to define our core values, including person-centeredness or inclusiveness. So a bit what we learned also from Michigan. We evaluate the stakeholder dialogues and policy briefs, for example, and so far all participants, the feedback was always positive to the opportunity to really sit together with other organizations or other stakeholders to discuss these issues, and us being perceived as the neutral moderator in that case, or the facilitator. And it has been so far very positive, the feedback that we have received. In terms of the main lessons learned, and Stefan is going to pick up on this for the second funding phase, is that we know the Swiss health system is not only highly complex, it's also very fragmented, the health system. We're dealing with 26 cantons that all have their own health system, so to say, and we're a very, very small country. And it just takes time, of course. It's a new initiative, the SLHS, and it takes time until sufficient awareness and advocacy also for it is created. The next step is not only, or what we need to do is that it's a lot of effort, not only to develop the network, but, and Stefan has already referred to that, we need to really make sure that collaborations are of mutual benefit for all partners, participants, stakeholders, that we don't encounter stakeholder fatigue, and that people really feel they contributed to something and they actually receiving something in return. Of course, we further need to develop our project mechanisms. So also in terms of monitoring, for example, which I talked about briefly, like how can we continuously monitor potential changes? So part also of the second funding phase is now that we're really coming up with a clear monitoring plan so that we can see what sort of changes are eventually taking place. And last but not least, which is not surprising, the implementation of learning cycle requires quite some time, financial resources, but also personal resources. And that leads me actually back to the question, who is actually responsible in the end to follow up on these learning cycles? We as an academic network, or should we make stakeholders more accountable? So these were for us the main lessons learned, but we are trying to address them actually in the second funding phase of the Swiss Learning Health System, and handing the word over back to Stefan.
Thank you, Sarah. And you can go on to the next slide. So I'm talking a little bit about where we are going over the next 4 years. Like I mentioned at the very beginning, we have this first funding phase that was completed just last year. We are now at the beginning of the second funding phase, and we used, the sort of last year to, critically reflect on what has happened in the past and where do we want to go in the future. And as part of that, Sarah, nicely summarized, our main lessons learned, and also sort of the issues that we faced in the first funding phase. And I would like to say a few words about, what is going to change, and what kind of things these changes aim to address. And then based on that, perhaps we can also discuss your views of the Swiss Learning Health System, these ideas of the Swiss Learning Health System, and perhaps also your opinion about whether, from your perspective, this is something that where you see perhaps certain issues, or perhaps something that you experience in your context where, certain things work better than others. So in a sense, we are also a learning health system here in this collaboratory. So we should learn from our experiences. So one of the first aspects that we, noticed is that, given that this is a small country, there is actually the scope of involving basically all academic institutions in the country. And in a first step, what we aim to do is expand and strengthen our academic network. And basically now, apart from, I think, like 3 or 4 institutions, we have basically all universities involved, and the universities of applied sciences involved in the Swiss Learning Health System. So, in terms of expanding the academic network, we are basically on a national level already. This is part of the funding as well, but it's also part of collaborations that we have with other academic institutions. What we also did is last year we created what we call working groups to foster the collaboration within the network. This is mainly done to, continuously develop also the mechanisms, because we, like Sarah described before, there are these different elements of evidence generation, of stakeholder interaction, of implementation, monitoring, and evaluation. And what we noticed quite early on, that whether this mechanism works or not is highly context dependent. And we saw that there is no sort of uniform model that works for everything. So we are, at this point, we are trying to make this model a bit more flexible to be adaptive to different situations, different contexts, different kinds of stakeholders. And this is something that, on the one hand, is sort of a learning by doing process, but it's also a structured process from research. So we also do research on learning health system and how this model can be implemented. Next slide, please. Next slide, please, Sarah. Thank you. So here's an overview of these working groups that we have. So we have one group that specifically targets the policy briefs and stakeholder dialogues and how this works. We also have a working group that develops the governance of the Swiss Learning Health System. and how we integrate the stakeholders in the governance, systematically integrate the stakeholders in the governance of the Swiss Learning Health System. We have a working group on the PhD program. As I said before, I mean, PhD students play an important role in the Swiss Learning Health System in terms of generating evidence, but also in the translation step. And we have a scholarship program that supports capacity building in this domain. And we also think that this is important. I mean, even if PhD students do not stay in academia, they are future healthcare leaders, and we want to equip them with this culture, with this knowledge of learning health systems. So they should also bring that in whatever role they have in the future. And we have another working group on what we call the data warehouse and metadata repository. This is sort of the digital infrastructure part. And I will say a few words about this data warehouse and metadata repository afterwards. Next slide, please. In terms of governance, like Sarah already mentioned, the Swiss health system is a highly complex system, and it's probably not very different from the US system. We have many different actors. We have different levels of governance. In Switzerland, the health system is, sort of on the federal level regulated, but also on the cantonal level regulated with responsibility of cantons, so states, for certain aspects of the health system. We have different centers of agency. So in terms of, bringing about change, implementing change, this makes it very difficult to bring these different parties on the table and then actually agree on a course of action to move forward. And like Sarah also mentioned, the Swiss Learning Health System or Learning Health System implementation just takes time, and coordination of the engagement and participation of the different stakeholders. So two ways how we want to address that is, first of all, also lesson learned from the first funding phase. A bottom-up approach of informing certain topics works, but also leads to a certain fragmentation. And what we decided early on when we planned the second funding phase is that we need to have some thematic clusters. And this is pushed forward now also on the governance level. And next slide, please. We have on the governance level, we have this academic governing board, which is basically the academic institutions that are represented. And what we bring in now as a new or two new elements is, first of all, a more structured approach in terms of thematic clusters. And second, we bring in a health system advisory board where stakeholders are represented, basically from all levels of the health system, whether it's from the government, federal or cantonal level, or even community level, or whether it's sort of the different health players like hospitals, physicians, the pharma industry. They should all be represented there. In terms of thematic clusters, and for that also next slide, please. We are, sort of building our thematic clusters on the Health 2030 strategy by the federal government. This strategy defined 8 objectives where they want to push forward the agenda. And we decided that we even do not want to touch on all these objectives. So we basically want to select certain objectives where the learning health system now becomes more active and less active than in other objectives. And for that we are planning. Yep.
Stefan, I'm wondering, since we have several questions, whether I could ask you to finish in the next minute or so this part of your presentation. So
that's perfect. That's about what I need.
Okay,
that's
thank
about
you.
What I need. So what we are doing now is we are trying to, we are implementing workshops, we are implementing stakeholder meetings, where within these objectives, we try to identify the most pressing issues that the health system faces. And then based on that, we start our learning cycles. We continue also learning cycles from the first phase, but in this way, we try to address better the health system needs. Next slide, please. And I mean, this is actually the way that we do that. So with calls for joint proposals. So this is sort of our systematic, I mean, way of interacting with the stakeholders. Next slide, please. This is something that I wanted to briefly comment, and I also said at the beginning. So what we have established over the first 4 years is a metadata repository, which allows a structured access to metadata of available data sources in Switzerland. And there are different ways of getting information from different sources into this metadata repository. This has been implemented. This is working well. And now we are actually sort of in the next step of making use of that. And there are different ways and different ideas that are ongoing. And we have been in touch with Chuck and also, I mean, others in Michigan about that. Especially the knowledge grid is something that we see as a promising route in the future. So that's something where we want to invest more in order to implement something like a knowledge grid also in the Swiss Learning Health System. Next slide, please. And that's basically it. So what are the take-home messages from this presentation? So first of all, Swiss Learning Health System is a national initiative to support evidence uptake in policy and practice. The way that this works is a structured cyclic mechanism with issue identification, evidence synthesis, a stakeholder dialogue, and then implementation, and then usually it continues going on. And to be fit for the future, what we aim to do is strengthen our network and the collaboration within the network, including the stakeholders. We have or try to establish an adaptive structure that aligns with the health system needs. And for us, most important is to create this learning health system culture and infrastructure in Switzerland to continuously improve the health system. So thank you very much. And we are open for any questions.
Sure. Thank you, Stefan and Sarah, for this excellent presentation. I'd like to call on Victor Rentis. Victor, if you can unmute to ask your question.
Sure. Thank you so much for the presentation. Just wondering about the multidisciplinarity aspect of learning health systems and the fact that there is a network of universities and departments, and wondering if you could talk a little bit about the challenges associated with just having people from researchers from different fields and departments collaborating together and using different research methodologies and often using different terms and talking about the same thing sometimes from a different perspective and using different terminology. And so some of the challenges associated with bringing professionals together in that sense.
I think that, I mean, that's actually a great question. And I mean, surprisingly, we did not encounter that many challenges in that respect. And I mean, this is especially surprising in my view, because I mean, if you look at our network, I mean, it's exactly what you just described. We have people from, I mean, sort of from a health background, health professions, from medicine, but we also have people from the social sciences, from law, from economics, from political science, even theology is involved in our network. And this model of, I mean, sort of knowledge translation through stakeholder dialogue, this is something that basically, I mean, works in all these disciplines, at least based on our experience. And our common goal is to, I mean, continuously improve the health system, whatever the thematic focus is, but this is our common goal. And this is where we agree. And this structured mechanism, this is also where we agree, that this is the way to move forward. And in that sense, I mean, even if there are different methodologies, different sort of, I mean, approaches to certain problems, I think that's actually the strength of the network, that we can bring in these different perspectives. And that goes as far as, I mean, having policy briefs and having, I mean, certain topics tackled in these multidisciplinary teams. So I think that's actually, I mean, one of the strengths of our system, that we can integrate these different views. So we do not face this challenge of sort of looking at a specific problem only from one disciplinary perspective and sort of ignoring everything else that is around that. So in a sense, I mean, for us, it was quite surprising, but despite these different disciplines involved, I think, I mean, this idea of a learning health system that we push forward actually works quite well.
Thank you.
Chuck, you're still muted.
Yes, I just saw that. Thank you. Thank you. Eloise Salmon has a question. Eloise, are you able to be unmuted and put your question forward?
Can you hear me?
Yes.
Hi, I was hoping you could comment a little bit more on any geographic variation that you see in health outcomes within Switzerland. Despite its small size, some of your comments about the proportion of the population that now needs subsidies and hospitals within individual valleys made me wonder if part of what you're hoping to learn through the learning health system is whether there are ways to sort of address geographic variation depending on the needs of individual populations.
Yes, absolutely. So, first of all, there is substantial evidence for geographic variation in Switzerland. And there are many reasons for that. So, one of the, or perhaps two dimensions of this variation, just to mention a bit, two dimensions of the variation is, first of all, these urban-rural differences that we have in terms of health outcomes, but also in terms of health services access. We also have, quite a gradient between urban and rural areas in terms of socioeconomic status. And this, of course, relates to health outcomes and relates to healthcare access, despite universal healthcare. But it's still, sort of, something that we observe. The other, perhaps even more interesting geographic variation in Switzerland is across the three language regions. Again, referring to what we saw in the initial word cloud. We have these three language regions in the country, and you can, nicely see in sort of this spatial analysis differences in health outcomes, differences in preferences for healthcare, differences in opinions about healthcare, differences in opinions about health policy directions across the language borders. And this is extremely interesting, from a research perspective, of course, but it's also, for us from the learning health system, it's quite important. And again, for this reason, we are quite happy that we are represented in all three language regions. And again, this helps us to understand certain problems a bit better and why they occur in certain regions more than in others. So geographic variation is definitely a big issue in Switzerland. Or how shall I put it? So it's something that exists, but it's something that can be addressed, of course. So perhaps big issue was the wrong word that I used. But it's something that we use in our learning cycles, also to learn, for example, from one language region for the other language regions. So that's something how this plays out in our structured mechanism.
Thank you.
Very interesting. Thank you.
Maybe I can just quickly add something to.
Sure,
to
Sarah.
It's, I think Stefan put it very well. We're learning from other regions because from a policy perspective in Switzerland, addressing the fact that there are differences between language region is sometimes perceived as a bit critical. So I think you put it nicely by saying we want to learn from the other experiences. Pointing out that there are differences is always a bit of a diplomatic issue, of course, just as a side note.
Okay, thanks, Sarah. We're going to have time, I think, for one more question. And Rashan Paudel was a double poster. He put two questions up. Rashan, ask whichever question you want to ask first, and we'll see if we have time for your second.
Sounds good. Thank you so much. I think you answered part of my first question around involvement from private stakeholders when you responded to Matt Sullivan's question. My question now, if you can comment on that a little bit, that would be helpful. But with the cancer-related patient-reported outcomes, were you able to consider integrating some of that data into your electronic health records at all?
So, I mean, perhaps answering this question on two levels. First of all, we are not there yet in terms of electronic health records where we would like to be. Meaning that there is no national sort of electronic health record system. There are some hospitals that implemented electronic health records, but this is not systematic yet. Even worse, it's not standardized yet in any way. There are initiatives that aim to standardize that. Yeah, so I think we are not there yet where the country wants to be. Whether patient-reported data is included in these electronic health records, as far as I know, yes, they are. But again, this is on a very local level. So there are some hospitals that systematically collect patient-reported outcomes, and they also integrate that in their electronic health records. But this is not done in any sort of standardized way across different institutions. What is also still lacking in Switzerland, and maybe that's actually a good sort of input for us also, maybe as a topic, as a thematic cluster to move forward, is this interaction then between hospitals, which are perhaps those that are most advanced on the level of electronic health records, and the interaction of hospitals then with other healthcare providers. So, I mean, this intersection between different healthcare providers also doesn't really work well yet. So, I mean, actually, one of the things why we would like to, have electronic health records is to simplify this process, but this is something that is not well working yet. So I think that's an issue that needs to be tackled, and I think the government put that on the agenda. This probably takes a bit more time to be systematically done in the country.
And
So I thank you. Thank you so much, Stefan. I think this brings us to the end of our time today. I'm looking at some of the other questions in the Q&A, and there was enough overlap between them that I think by the by, with the answers you gave to some of the questions, you also touched on the answers you would have given to many of the others. We had several questions from our colleague in India, Mayank Agarwal, and I know he's going to be interested in talking to you. So I'll connect you directly by email with him. You did touch on some of his questions. Okay, so this brings us to a close. First of all, let me thank our speakers, Stefan Buss and Sarah Montville, for their excellent presentations. I want to thank all of you who attended for your excellent questions. As always, we have a post-event survey that will be available to you via a link as you exit the webinar, and I will tell you that we take your comments very seriously. This more interactive Q&A format, and we thank our speakers for the online polls, our response to your survey comments. So keep the comments coming. A link to the webinar materials will be on the Collaboratory archive website, which you can address at this URL. This is our last seminar session for this academic year. We have another exciting year planned to begin in the fall. Details about this will become available in the next few months, and so stay tuned for more information about these seminars and these two upcoming learning health system workshops that we will be offering this summer. One, an overview of learning health systems, and the other on the care and feeding of multi-stakeholder learning communities. So thank you again. Thanks again to our speakers. Have a terrific rest of your day. Bye, and thanks for attending.
Thank you very much for this nice collaboratory. Have a nice evening. Bye-bye.
Thank you.